Angina is a kind of a chest pain. It's usually caused when patients they feel discomfort in their chest, and it's usually because of the reduced blood flow in the heart. The arteries that supply the heart they have reduced blood flow. So because of that, they can't get enough oxygen to the muscles of the heart. So it's a very common symptom of a coronary artery disease, and wherein these arteries, which supply blood to the heart muscles, they develop narrowing or blockages. So angina, chest pain, is a warning sign. It can be an impending sign of doom, like a heart attack. So we need to take it very seriously. Angina, in medical terms, we usually classify it into four categories. One is the stable angina, the other is unstable angina, then another is a variant or a Prismental's angina, and then is a microvascular angina. So stable angina is the most common type, and it's often triggered by any exercise or exertion. So any type of physical exertion, mental exertion can also cause symptoms of angina to a patient. This is usually a predictable and consistent in nature, and it's often relieved by taking rest or any medication that's given by the doctor for angina. Now, unstable angina is a more severe and unpredictable type. It's usually a case of medical emergency. If it goes untreated, it can also cause a heart attack. Then variant or Prismental's angina is usually caused by a coronary artery spasm, where there is no significant blockage in the coronary arteries, but the patients may feel similar symptoms to stable or unstable angina. It usually goes away on its own, maybe after taking some rest also. Then the last one is a microvascular angina. This angina is also called as syndrome X angina. This is very difficult to treat at times because it's caused due to some abnormalities or reduced in blood flow in the microvessels. So these are very tiny capillaries or microvessels which supply the muscles of the heart. So whenever an angiogram is done to look for any blockage in the coronary arteries, usually those arteries are normal. There is no blockage. But because of the dysfunction of these microvessels, there is reduced blood flow or oxygen to the microvasculature or muscles of the heart, and so they produce a similar type of symptoms as a stable or unstable angina. Angina, I have already told, it's just a chest pain or a discomfort felt by a patient due to the reduced blood flow to the heart, while a heart attack is a more severe condition and a serious one. So, in heart attack, there is a complete cessation or blockage of the blood flow to the heart muscles. It can cause permanent damage to the heart muscles. So, angina is a temporary reduction of the flow to the heart muscles, whereas heart attack is almost a complete cessation of blood flow to the heart muscles. So, if heart attack goes untreated for a longer duration of time, it may even lead to permanent damage to the heart muscles, as well as can also lead to death of the patient. So, stable angina is a lesser serious condition, whereas heart attack is a medical emergency which requires immediate treatment in the hospital. Patients of angina, the symptoms can come in various forms from the patients. Some patients might describe it as a squeezing or some pressure or tightness in the chest. The patients can also say some burning sensation in the lower part of the chest. Some may say that there is left side chest pain, which may radiate to the left shoulder as well as the left arm. This angina can also radiate up to the jaw also. So some people may experience just shortness of breath, sweating, or even nausea. So these are very different symptoms. Some patients might give typical symptoms of angina, like the chest pain radiating to left arm, and some patients might just say that they are feeling some shortness of breath or sweating or some nausea. Angina is usually diagnosed, one is with the help of the symptoms, when patients describe such kind of symptoms, then uh, doctors may think that the patient has angina or coronary artery disease. uh, then the doctor will take the history of the patient, and if there are various risk factors associated and the doctor thinks that this is definitely looks like angina, so doctor will get some tests done, like an ECG will be done, and depending upon the ECG, the doctor will order an echocardiogram. And if the doctor feels, then a treadmill test, a stress test, which is, and also a dobutamine stress echo is there. So various forms of stress test can be done, or a coronary angiogram can be done to look for the blockages in the coronary arteries. Treatment of angina depends upon the type of angina the patient has, the seriousness of angina, and we also need to tackle the associated illnesses if a patient has. So if the patient has high blood pressure, it needs to be tackled with blood pressure medicines. Cholesterol levels are, if they are high, then the doctor will prescribe medicines for cholesterol also. Then there are certain medicines like nitroglycerins, which are given to the patients of angina to relieve their symptoms. Doctor will also advise some lifestyle changes to the patient. And if the blockages are too much in the coronary arteries, depending upon them, doctor might advise you for a coronary angioplasty, that is stenting, or a bypass surgery. There are many lifestyle changes that a patient of angina or coronary artery disease needs to follow. One is if a person is smoking, so they have to quit smoking. So there is nothing like a safe limit of smoking, one cigarette, two cigarette. They'll have to completely stop smoking. A healthy diet needs to be followed. The doctor or your dietitian will advise you a healthy diet that needs to be taken by a cardiac patient. Even secondhand smoking or any form of tobacco products are not allowed for coronary artery disease patients. If the patient has high blood pressure or diabetes, they need to lower their salt intake and avoid taking high carbohydrate diet or sweets to kind of keep their sugar levels also under control. Then light walking and some form of yoga can be advised to such patients. The doctor can advise such kind of exercises depending upon the type or severity of coronary artery disease the patient has. Usually, the exercise is limited to 2.5 hours every week. So, patient can go for a walk or find other activities that the patients can enjoy. So, also the medicines that are prescribed by the doctor needs to be taken very judicially. So, they might include blood pressure lowering medicines, cholesterol lowering medicines, as well as medicines which are called as blood thinners. So these are the certain lifestyle changes that a person needs to follow who has angina or a coronary artery disease.